are group Reese.
I'm Julie Becker.
I'm Grace Gibson.
I'm Kara Midlodge.
I'm Jamie Aiken.
And we will be presenting on the OWLS 2, or the Oral and Written Language Scales 2nd edition. Alright, so here's our advanced organizer. In this presentation, we will be covering general information about the assessment, the purpose of the assessment, content, the subtest, the language subtest domains and descriptions, testing procedures, the norms, the scoring information, validity and reliability, the practical features of the assessment, as well as desirable and undesirable features about the assessment, and then finally evaluation. Okay, so OWLS 2, the authors, Dr. Elizabeth Caro Woolfork, as well as Kathleen Williams. Publication, Western Psychological Services, California. The demographics, they were representative of the US Census at the time of 2011. And the administration time, listening comprehension scale takes about 5 to 15 minutes, and the oral expression scale takes 10 to 25 minutes. Here's our demographic information. This table here lists specifics about the demographics, but the demographics in those gender, race and ethnic background, parents' educational level, and the U.S. geographic region, those were all considered in the U.S. Census demographics of 2011. Here's the purpose of the OWLS 2. The assessment is designed to identify strengths and weaknesses in language and to determine the existence of language delays and disabilities, specifically receptive and expressive language as well as written language skills. And the target population are children 3 to 21 years old with receptive and expressive language difficulties whose language is English. Now, Kara?
So the linguistic structures measured in this test were the linguistic, lexical, / semantic, that would cover the vocabulary, as well as nouns, verbs, modifiers, idioms, prefixes, and suffixes. The syntactic parts of this test measured were the sentence structure and grammatical markings. The supralinguistics were non-literal language. The pragmatics included functional use of language, and the text structure was the use of categories to make longer sentences, and then conventions such as fine motor, spelling, and punctuation and writing. So the instrument content subtests were listening comprehension, oral expression, reading comprehension, and writing expression. So the listening comprehension of this test focused on oral language reception. This was done by listening to and comprehending spoken language. The format of this part of the test was administering items presented verbally and pictorially, and then responses were given primarily by pointing on a multiple choice item. This part of the test takes about 10 to 20 minutes to administer and is normed off of ages 3 to 21. The oral expression looks at oral language expression, speaking, and then the format is the items are presented verbally and pictorially as well, and then responses are given verbally. This part of the test takes about 10 to 30 minutes to administer and is for ages 3 to 21. The reading comprehension component of this test looks at writing language reception, so reading and comprehending written language. The format for this part of the test is items and responses are presented in text, and then responses are given by pointing or saying the number of the response on a multiple choice item. And then this part of the test takes 10 to 30 minutes as well, but this part is for ages 5 to 21.
So the final section, or the final subtest is written expression. And this section covers writing, and the items are presented verbally and visually, so some are in the text and then some are presented in pictures. The responses are written, and it takes 15 to 30 minutes, and it's for ages 5 through 21. The testing procedure. So the materials used are reading comprehension and written expression test easel, the RC and WE record form, and the RC and WE manual. So they follow the prompt provided on test easel, and then you want to make sure that you sit across from the client so that you can still read the back of the easel, but also see what the client is pointing to on the front, and then you'll provide feedback. So the norms, they're age stratified, so it is very dependent upon the age of which section of the test you'll start with. It's based on a sample of 2,123 individuals from 31 states, ages 3 through 21, representative of the U.S. population in regard to ethnicity, gender, parental education, and region. So for scoring information, it is based on age and grade-based standard scores, test age and grade equivalents, percentile ranks, and descriptive categories. So for scoring information, to get a better idea of oral language, we'll use listening comprehension plus oral expression. For written language, we'll use reading comprehension plus written expression. For receptive language, we use listening comprehension plus reading comprehension. And for expressive language, we use oral expression plus written expression. So to get an idea of their overall language, we'll add all 4 subtests together.
So for the interpretation of the scores, we use raw scores and we convert them into standard scores. This allows the results to be compared with those of standardization samples of typically developing individuals. So this interprets the scale scores and composite scores. For standard scores, the mean is 100 and the standard deviation is 15. And for age-based standard scores, this is recommended if the clinician is identifying a learning disability. For grade-based standard scores, that's recommended for curriculum planning. And for descriptive ranges, this translates the numbers into natural language easily understood by parents. So that's a really good option if you're trying to help a parent understand this, the scores well. The descriptive ranges are exceptional, above average, average, below average, and deficient. So for different types of validity, we have content and construct validity. Content validity, basically if the child's case fits the guidelines of the test, then the measures can be considered relevant and valid. The scores distinguish typically developing individuals from those with speech and language disorders. So the OWLS 2 factor analysis supports the validity of underlying constructs of integrative language theory. For construct validity, the OWLS 2 is based on the integrative language theory, which describes the conceptual domains of language processing. The intercorrelation analysis shows that it's legitimate and, to score and interpret the OWLS 2 separately from one another. The scales are designed to provide access to these constructs through their standard scores. And each subtest can be administered on its own, and each one is valid. For predictive validity, basically the definition of predictive validity is the extent to which a score on a scale or test predicts scores on some written criteria, on some criterion measure. The manual for the OWLS 2 test did not address predictive validity, so it does not have any predictability measurements. For reliability, in the speech and language impaired sample, all internal reliability coefficients are 0.95 or higher across tests, composites, age ranges, and forms. In the clinical sample, all internal reliability coefficients were 0.93 or higher. So the inter-rater reliability was estimated using interclass correlation coefficient. The replication of high internal consistency reliability across both typical and atypical samples provides evidence that the OWLS 2 test will yield internally consistent, stable scores in the setting where it is most likely to be used. So this indicates a high level of agreement between different raters who use the same criteria to score.
Okay, so some practical features of the OWLS 2. It is administered individually, so just the client and the clinician will be in the room. It is scored by hand, so a score sheet is provided with the test kit. We found the manual to be very well organized. It was informative about how to administer the test. It taught us about how to find norm reference scores in the manual, and they were easy to find, and it had an appropriate layout that was also easy for us to read.
some desirable and undesirable features about the OWLS 2. For desirable, all four subtests gave us details about our clients' abilities in language. Distinct and critical aspects of language were measured in this test, and clients were only exposed to items on the test that were appropriate to their age level and ability level. Some undesirable features we found was that since the OWLS 2 covers such a broad age range, it lost some specificity, and as Grace said earlier, it didn't include predicted validity, so we were kind of unsure about whether it actually measured for that. Overall evaluation. Overall, we found that this test was really easy to learn and to administer. The manual itself was very informative about how to administer the test, and it also gave examples and case study examples. We also found that it determined the client's strengths and weaknesses of language across many domains, and then we decided that this test would be a good starting point for us to determine our intervention plan. Okay, so post-organizer, we gave you general information about the OWLS 2, the purpose, content, subtest language domains and their descriptions, testing procedures, the norms, scoring information, validity and reliability, some practical features about the OWLS 2, desirable and undesirable features, and our overall evaluation of the test. And the STAR references.